Well, greetings, everyone. Today, again, we have asked back Garren Colvin, CEO of St. Elizabeth Healthcare. And Garren, this has been an unprecedented time for you and your team dealing with this pandemic. And so things are different every day, but how's your team at the hospital? And again, it's a big day being Nurses Day, I think National Nurses Day. And how is your team doing and how's the hospital?
Kris, thanks for having me back. Absolutely. And thank you and all the judge executives for what you're doing. This is great. Getting out, getting the word to the public is one of the most important things we could possibly be doing at this point in time. It is Nurses Week, so my love and appreciation goes out to all the nurses, but especially those nurses that walk through our doors each and every day. As well as every coworker of all of our nurses that walk through our doors each and every day. Things are great. As good as one could be expected in the time of a pandemic. We've lost a lot of loved ones, but we've saved a lot of lives throughout the state, and that's what we should be focusing on. Paying respect to those who have gone, but really making it an upbeat. We've done some great things across the state, and we should be celebrating that.
So let's speak to what's going on. Your doors are opening back up to some of the key treatments, but also, one of the sad notes, and we want to make sure we get cleared up, is the fact that some people maybe have been reserved about going to the hospital, or maybe even worried about calling their physician if they've got an issue. We don't want them to do that. They need to move forward and reach out, but maybe you can calm their fears about going to the hospital and being treated.
Absolutely, Kris. I can tell you that at probably at our low mark, we probably were down about 60% in all of our physician practices, and the hospital volume was absolutely down to some of our lowest levels. Most of that was due to the stoppage of elective procedures and elective surgeries, but unfortunately, a lot of that has been a fear of wanting or not wanting to come to the hospital. The thing I can share with you, and I've said this and you've heard me say it in a lot of the meetings that we have week after week, the hospitals are the safest public spaces you could possibly be in, and primarily because of the steps that we've taken in order to make it a safe environment. We take temperature of every employee every day. We are masking 100% of our employees, 100% of our patients, 100% of anybody walking through our door, vendors or any essential people to make this place run. So it is safe. And since we've taken those steps, which were much more onerous than what the CDC was recommending, we did it for the safety of our patients and our associates. And since then, we haven't had a hospital-acquired spreading of COVID-19. So we know that this is a safe place. And we are finding a lot of our patients hitting our doors in our emergency rooms now are really sick. And so we know they've been staying home and avoiding either their physician or the hospitals out of fear. So all we're trying to do is get the message out. So thank you for the opportunity to get that message out. And it's an important message. We are unbelievably safe. The governor talks about it in his 5 o'clock press conference. I will say it anytime I get a public voice, public media. We need people to be safe because, unfortunately, we've probably lost a person or two in our community as a result of not wanting to come forward. And the road to recovery is going to be a lot longer the longer you wait to seek care.
And I guess obviously I have no expertise in healthcare, but it seems like it's all a constant level of balance. You're dealing with the need to provide care, but you've got this unknown disease out there. So you're constantly taking actions and things evolve. I would assume processes and procedures are evolving daily.
Absolutely. So we have a 4-phase approach to the reopening of healthcare. And so when we first were restricted, we categorized all of our surgeries and all of our kind of procedures. We lumped them into urgent, emergent, and then elective. So when we did that, we took those steps about 45 days ago. What we're finding is some of those cases that we had to put off because they weren't emergent or weren't urgent, they were emergent, have now become urgent.
Gotcha.
And so we only have the ability to rely on the individual to bring that forward, because if they're not showing up, they're not calling their physician, they're not coming in, we don't know that they've gone from emergent to urgent. And that's really what we need. The one thing I will tell you is our physician organization, top notch across the board, but they were preparing their practices to meet the needs of individuals in our community. So we were gearing up telemedicine, not because we were thinking this big pandemic was coming, but just because we wanted to meet the needs of our community. So when we started relatively slowly, we were doing about 4 or 5 visits a day. This week we hit 2,000 visits per day.
Wow.
That's amazing. And you think, how many of those will stay electronic versus coming in public? And what we'll say is, hey, if we can meet the needs of the patient and the physician doing it electronically, we'll see probably more electronic televisits. But if not, then we need to get people coming in, and we need to make it as safe. So I have a long list of the things that we've done to make it safe, and I don't want to bore you with it today, other than to let you know, I come to work every day, and guess where I'm coming to work every day? I'm coming to the hospital. So, my wife would not let me come here if she thought it wasn't a safe place. Trust me.
Indeed. Well, and there's two other questions I would ask you, and that I've heard from people. So today, I think that I'm feeling bad. Is there any different thing that you're recommending I do today? I'm starting to feel bad. I've got maybe a little chest congestion. I got a little fever, and what should I do? And then should I do something different than I would have done a few weeks ago?
So if let me just take that example and break it down into 2 categories. If it's a routine illness that is not symptoms of COVID-19, I would reach out and call your physician, and they'll give you the guidance that you need. And we do have an 800 number that St. Elizabeth Physicians has set up, 1-800-737-7900. That is for any, you don't have to be a SEP physician patient to call that number. They'll direct you. But the main thing is, if you have COVID concerns, absolutely call the physician. And what I would say, if you're symptomatic, you want to call your physician. If you can't get through your physician, call the ED. Don't just show up. And then they'll direct you, and that you need to mask up and then where to go. Because we've tried to separate the opportunity for testing so that you won't have to come to the emergency room. And that's just another way to keep this whole system safe.
Sure.
So we do have quite a few testing locations throughout our community that are associated with a physician visit through all of our urgent cares, 2 respiratory clinics. And then what we really want to save our 5 emergency rooms for are the really, really sick. But pick up the phone and call someone, and they can make you feel better about the steps they're taking to keep you safe as a patient.
And, things have been better than, the worst case scenario that everyone kind of thought about a week or 2 ago. You had to plan for that, and thank God you didn't have to be impacted in those kind of levels. Where does St. E's look today? I mean, as a wave might come back with people get sick, or do you have the capacity? Do you have the ventilators? Do you have the healthy staff to handle whatever might come to Northern Kentucky?
So absolutely, the short answer is absolutely, but let me give you some assurances. So at the worst, at the height of our highest patient volume that we received at St. Elizabeth, which was on the heels of getting about 45 nursing home patients from 3 nursing home facilities, we were still below 50% of our isolation capacity just at Fort Thomas.
Wow.
So we have much more capacity than what exists at Fort Thomas. So we're not even close to the capacity, which is great, a good problem. Thank you, community, for social distancing. Absolutely. The ventilator situation, which has always been a big concern, we have 5 patients today on ventilator, and we have the capability to ventilate through several means 200 patients. So you can see there's, as a CEO of the system, I'm not concerned about capacity, and I'm very comfortable that we have the ability to reopen the healthcare in this community and keep a reserve of capacity for any spikes that you're going to see when you reopen the economy. And trust me, there's no way to avoid a little bit of a surge associated with the reopening of economy, because this is a community spread disease. And since we really don't have a community because we've been isolated, once you bring that community together, you're going to need to be prepared for just, a spike, hopefully significantly less than the first spike, and something that we can deal with. And you asked a great question. How are we going to maintain safety, not inside the walls of the hospital, but outside the walls of the hospital in the community? So our business health center is willing to talk to any business who wants to have a consultation free of charge, just to say, how can I keep my business COVID free or stop the spread of COVID within the walls of my manufacturing plant, my doctor's office, whatever. And we'd be willing to share that information. And it's going to be some of the stuff I talked about earlier: temperature taking and masking. And I know there's some people that kind of don't appreciate the masking component. I can tell you, it's the safest thing we can do. And a lot of times, the people wearing the mask are protecting everybody else from, their coughing and their sneezing, as opposed to the other way around.
And that's one of those areas, it seems like it has evolved also over the past even 6 weeks, that opinions about that. Do you want to speak to that at all in terms of maybe where it was before and where that opinion is now?
The thing I can tell you is that the masking made a world of difference inside the walls of our medical center. And to the point where early on, even before you're hearing anything from Governor DeWine or Governor Beshear, we made a decision internally that we're going to continue masking until we have a vaccination for COVID-19, primarily because it's the safest thing for everybody involved. And so, I'm a fan of masking, and I hope that the community can embrace it, because I think it will help. It'll help stop the spread throughout the community.
And lastly, I guess to end on another high note, it seems like there's even daily news about vaccines, the studies, and I know that you've got some partnerships that are ongoing. Is there anything in that area that you could share with us or educate us about?
Here's what I would say is this community is absolutely blessed to have CTI headquartered in Covington, Kentucky. They're an international company. They're worldwide, doing amazing work. And yes, we have struck a partnership with them. Probably some more formal announcements coming out recently, but we will be able to get access for people in this community, medications that won't be on the market for years. And we've had a few patients get the Gilead drug, which is kind of the hot topic, and all of those patients have done really well. Kind of this little hospital in little old northern Kentucky is, we have access to some worldwide technology, which is
well, and it's cooperation. You guys are working with everybody, and I know there are lost lives. There are going to be other lost lives in our community. We, of course, mourn those and support their families and pray for them. But I know you guys are continuing to do great work every day. So, if there are any other closing thoughts you have as a community message to Northern Kentucky about our healthcare, where we need to go?
No, the thing I would say is this: is that the outpouring of support from this community has been phenomenal. Our staff, physicians, independent, employed, our associates, they've stepped up. I just look for the day, and you and I have talked about it, where we can have a couple bourbons and celebrate what this community has done and made it through. So I really look forward to that day.
Well said. Thanks, Garren. Really appreciate everything.
Thank you, Kris.